I will know you. I will show you respect. I will go with you on your journey. I am here to help you. That's what it means to provide the Bellin Experience. When Paul Vlies, Bellin's Director of Facility Management and Security, asked Rosie Bartell and her late husband David to become patient advocates, his goal was to leverage their experience to make Bellin facilities accessible and welcoming for all. The friendship that developed really spotlights what service excellence is all about. That is why Paul is the recipient of the Values in Practice Award for Service Excellence.
I think the first thing that he ever did for us was he called me and said, we'd like to come and talk to you about being part of our facility management group. And he said, but we'll come to you. Now, I've done a lot of volunteer work with patient experience, but Paul was the first person that ever came to me.
The first meeting with Rosie was all about a way for our teams to better value and appreciate their contribution to patient experience and outcomes. So our leadership team decided to sit across from the table from her and her husband and be able to talk with her, get to know her, and ask questions. And it just took on a life of its own after that.
And so he came to us saying, would you be interested in helping us with talking to our maintenance men and sharing your story, talking to our service people, our security people, talking to anybody that we might have you talk to. And it's not going to be a one and done. Paul thought we were able to help, first of all, because I'm in a wheelchair, and sometimes they don't think about how things in a wheelchair happen. Plus, they also knew that I had traveled to a lot of hospitals, seen a lot of things, done a lot of patient experience work, and I could bring something to the table that they didn't have.
Paul demonstrates service excellence in many different ways. Listening to patient advocates, like Rosie, for an example, and truly listening to what she has to say, not just hearing her, but truly listening to what she has to say and responding.
What Paul showed us very quickly was that he was about service, he was about caring about patients.
We found out that David was diagnosed with cancer and that it was bad. And 30 days later, he passed away. Rosie had become a good friend and a valued team member by that time. David surely was the same. And I think it just, like if a tragedy happens to any team member, we're gonna reach out and help.
Some people will come to the funeral, and that's the last you'll see of them. But that wasn't Paul. Before he even left the dinner of the funeral, he went to my sons and said, what do you think Rosie needs? What do you think she needs to be secure to live alone? And so one of my sons said, I think if you got her an eye wash that she can wear in the shower, she can connect to us, and if we can get somebody to her quickly, I think that's what she needs. Well, Paul made sure that happened.
I would say serving others is very motivational. Timelines and budgets and preventive maintenance schedules, those are all very important. But if you really want to motivate someone, you tie it to somebody like Rosie, a patient like Rosie, and their experiences and how you affect that. That's motivating, and that's job satisfaction.
I'd like to say congratulations to Paul because he is service. He is service excellence, and he emulates that every day of his life.
I'd like to congratulate Paul on winning the VIP Excellence Award. Well deserved. Congratulations, Paul.
First, I want to thank Rosie for nominating us. I want to thank the team, because without the teams taking this idea and running with it, then none of this remains part of our daily work, and none of it remains meaningful. So I want to thank everybody for that.